Hello, everyone. I'd like to reconvene the special meeting of September the 17th. So we'll start this off by saying that we received a lot of letters from concerned citizens of town and other users of facilities that don't live in town, and we've read them all. And if anybody would like to read them, they are on the agenda package that's on the internet right now. So we're not going to be spending all the time reading these letters, and a lot of the letters are they're so far off of what we're discussing today that it just would take a lot of time. So what we're doing today, just so everybody that's watching and everybody in the community knows, we're making decisions on how our facilities are going to operate. We're going to make decisions on how youth groups are going to fit into our facilities, and we're going to make a decision on the vaccination status of our employees moving forward. Just so everybody knows that we've had a lot of letters saying that other communities are absolutely doing nothing. Well, in actual fact, there's two choices that we have been put in front of us. And we are going to discuss the merits of both, and we're going to get the thoughts of every councillor, and then we're going to go ahead and we're going to make some decisions. But to say that other municipalities are ignoring the provincial government mandates, I don't believe that. And we're going to make decisions for our facilities and our employees. We're not going to make decisions for businesses. We're not telling anybody out there what they should do. We're telling you we're going to be making decisions based on how we're going to be using our facilities and how we're going to be taking customers in them. In some facilities, there will be no access to. Okay. So I would like to start off by somebody giving us the two options that the province has given us. Go ahead, Cliff.
On September 15, we received information from province of Alberta, and the overview says, Alberta has declared a state of public health emergency. COVID-19 cases and hospitalizations continue to rise, largely in unvaccinated Albertans. New measures to protect the healthcare system, stop the spread, and increase vaccination rates come into effect starting September 16. The province has instituted a restriction exemption program starting September 20. Discretionary events and businesses must follow one of the two options. Implement the restrictions exemption program requiring proof of vaccination or negative rapid test result to continue operating as usual, or follow capacity and operating restrictions as outlined below. So business requirements, businesses that implement the restrictions exemption program can operate as usual if they only serve people ages 12 and over who have 1. Proof of vaccination, single dosage accepted between September 20 and October 25 if received 2 weeks before time of service. Double doses required after October 25. Number 2, a documentation of a medical exemption. Number 3, proof of a privately paid negative PCR or rapid test within 72 hours of service. Tests from AHS or Alberta Precision Labs are not allowed.
Okay. So that's the exemption program.
Correct. The restrictions on indoor social gatherings. Vaccinated, Indoor private social gatherings are limited to a single household plus one other household to a maximum of 10 vaccine-eligible vaccine people with no restrictions on children under 12. Unvaccinated indoor social gatherings are not permitted for vaccine-eligible people who are unvaccinated. Weddings and funerals, indoor wedding ceremonies and funeral services are permitted with up to 50 people or 50% of the fire code occupancy, whichever is less. Indoor wedding or funeral receptions are prohibited unless the hosting facility implements the restrictions exemption program. Adult over 18 sport, fitness, recreation, and performance activities. The following restrictions apply unless the facility or program implements the restrictions exemption program. Indoor group classes and activities are not permitted. Indoor competitions are paused except where vaccine exemptions have been granted. Indoor one-on-one training and solo activities are allowed with 3-meter physical distancing. Outdoor activities continue with no restrictions. Youth under 18, sport, fitness, recreation, and performance activities, indoor group classes, training, and competitions are permitted, but participants are required to screen for symptoms, maintain 2 meters distancing, accept youth while engaged in physical activity, wear a mask, except while youth engaged in physical activity. Indoor recreation facility, indoor retail, entertainment, and recreation facilities. The part that applies to us is indoor recreation facilities. The following restrictions apply to any indoor facility that does not implement the restriction exemptions program. Capacity restricted to 1/3 fire code occupancy. Attendees must be within household members only or 2 close contacts if they live alone. Masks and 2-meter physical distancing is required. Outdoor events and facilities, fully outdoor events and venues have no capacity restrictions, excluding washrooms, but must maintain 2-meter distancing between households or 2 close contact for those living alone.
Okay, thank you. So I hope everybody understands that there's 2 choices that the government has made available, and that's what we're deciding today. We are not deciding which businesses in town are going to be expecting people to show up with the vaccine card. We have nothing to do with that. We are going to be looking at what facilities are we talking about today. Phil, what facilities are we talking about under that would come into effect? Or you want to go to Paul? Okay, I'll go to Paul.
Thank you, Your Worship. So the facilities we're talking about today, actually, if I could just go back before I get there.
Yep.
So the options are implement a restriction exemption program or not. So if we don't, Cliff has read the requirements if we don't implement it, which means that if we don't implement the restriction exemption program, no adult activities can take place.
Yeah.
If we do implement the restriction exemption program, then we have the possibility of impacting youth activities. So it is a quandary for sure. Yesterday, in the press conference that was provided by the Premier and Dr. Hinshaw, Dr. Hinshaw made mention of the fact that she's aware of municipalities putting in the restriction exemption program requiring youth aged 12 to 17 to be vaccinated to participate, and suggested that there was an option for municipalities to allow youth activities to continue and still have the restriction exemption program in place. So what we are proposing, is that, I'll just first go over the facilities that we plan to close to the public. I'll go over the restrictions and exemption program stuff last, okay? The facilities we want to close to the public are the public workshop, the fire department, the VMRF, the VIC, which is closing on Sunday anyway, and the museum, because we understand people are going into the museum when the corn maze is open. So, the facilities that will remain open will be the town office, all departments in the town office, because we believe we have enough safety in place for all departments, including FCSS. The landfill will be open. The requirements in those buildings will be the requirements for masking, social distancing. So that brings us to the areas that would be impacted by the restricted exemption program. So we are saying that we would fully implement the restriction exemption program for the social center, for the library gym, for the multiplex, and the aquatic and fitness center. Then we are proposing a hybrid model for the arena and the dance studio. And the hybrid model would be youth activities can continue provided they follow all the other restrictions that are required, which is screening for symptoms, social distancing, masking except when they're participating in their physical activity, 1/3 fire code capacity for spectator attendance, with attendees limited to a single household, or to two close contacts if they're living alone, and those attendees must be masked and social distanced. And we would expect that the youth organizations would police that like they did in the past, with the proviso that if that fails to happen, the full restrictions exemption program would kick in.
Okay, can I just stop you there? So what age group, are we saying 18 and down?
17.
17.
Up to 17, because 18 is an adult.
Okay, okay.
So that is our proposal for the restriction
Just
exemption
a
program.
note there, it would be ages 12 to 17, because under 12 have not been approved for vaccination.
Okay. Okay,
Can I ask a?
sure, go
I
ahead.
just have a clarification. If at some point under your recommendation, the groups were then to want to expand their capacity, would that then be reversible, that you could go to the full exemption? Because that might be a spot that regulations take over from other governing bodies, and then they wouldn't necessarily need to fall under that. So I just want to know if that would be then something they could change and become full.
I think that we could make that change. Like, right now, we're trying to make sure that the youth can continue to do what they need to do, to continue in their activities. If something changes in the regulatory bodies, for instance, a minor hockey has, it says something else has to change, then we are open to change it. We want to make sure that if the youth are going to participate or continue, that they follow the restrictions, and if they don't, then we have to go into the full restriction exemption program.
Okay,
And we think that that, as administration, is a fair compromise for everybody on this matter.
okay. So that is one issue. Which direction we're gonna go? We're gonna go with the restriction exemption program with the caveats that you just said. Or we say, no, we're gonna go to the other restriction fall back in where everybody has to be a cohort, and you have 1/3 capacity in our facilities. So this is a decision that was in front of council right now. what
And
we're gonna
no
do.
adults will be able to do anything.
That's right. So like curling, adult hockey, all of that is out.
Right.
So the only changes would be like adults, anybody over 18, it has vaccinations, proof of it can now be playing adult hockey, or they could be curling. But if we don't do anything, all those recreational activities stop.
Correct.
Okay. So just so everybody's clear, this is the decision that we're voting on today. And then there's one more that we're gonna be asked to vote on, and that's because under this restrictions exemption program, it doesn't say the employees need to be vaccinated.
It does not.
It doesn't. So we're gonna clarify that today too, so that the admin will know exactly what the path they're gonna take on this. So, is everything clear enough? The information that you receive what the ask of council is today. Moving forward, does anybody have any questions other than what Councillor Warwood just said about the youth? Is there any other questions? Then I will start. If anybody would like to make comments on their own, I said I would allow 5 minutes for each person to make a comment, each councillor, and you can start. We'll start down, we'll start with Councillor Barry, I guess, and we'll move down this way because there's, and just, I want everybody to understand that this is not usually decisions for municipal councillors to take regarding vaccinations. Somehow this got downloaded onto us. So as councillors and the mayor at this table right now, we are making decisions based on what we feel is the best way to use our facilities for our taxpayers in town. That's the decision we're making. We're not telling anybody that you need to get a vaccination today. That's not what we're saying. We're saying to move forward with the two choices that the government has given us, we need to operate our facilities. That's what we're deciding on. Go ahead, Councillor Barry.
Thank you, Your Worship. I'll echo your statements that this is a provincial matter of health. It's not a council matter other than the usage of facilities and our employees. Excuse me. I think that if any of us were to try and claim that we understood COVID, understood the options we have and understood vaccines, we'd all be fudging the truth. Even experts have difference of opinions, so I think it is good for us not to be sitting here debating as to which side of the fence we're sitting on or which is right and which is wrong. There are some facts. Vaccines work in the aspect that they reduce the severity of illness. There's some facts that they don't protect everybody. And the aspect is that the numbers keep changing. And that's the whole aspect of the ways that statistics and data is given to us, particularly when it's in percentages. If they reduce the number of available beds and you have more patients, the percentage goes up. So I'll stay out of that to the aspect of where we're really at. I appreciate all those who have written and expressed their concerns or interests from both sides. I've read it all. I think the only thing that is really judging me the most is the lack of clear direction that has been given to us from the provincial government. I think that what they have done over the course of time has not been clear to anybody or to any municipality. And things that were in effect a year ago, the conditions are not the same now. And as more and more individuals become vaccinated, the risk of the unvaccinated being in contact with somebody who carries COVID increases because it's not foolproof. The vaccine does not prevent every single individual from contracting COVID. You can be fully vaccinated and still come in contact with COVID and get it. And that's a proven fact. So as the pool of vaccinated increases, so is the pool of potential people who are carrying it and don't even know it. So the unvaccinated continuously become more at risk. And that's a choice that they personally have to take into consideration, that your odds are changing all the time. It's not the same as a year ago when everybody was equal because nobody was vaccinated. So the odds keep changing. So you have to take that into consideration. My only real point in terms of not really looking at any mandate that says we need to be vaccinated is the Charter of Rights. I really don't feel that in a democracy with our Constitution and with our Charter of Rights that it is appropriate to mandate a vaccine in order to do the things that we're asking. And that is actually even recognized by Dr. Henshaw, who just the other day stated that some municipalities and some businesses are insisting on fully vaccinated proof before they enter, but she cautioned that is not a provincial mandate. It is not a provincial position, so therefore these groups could potentially have legal action taken against them by Alberta citizens. So they're actually giving a cautionary statement to cover themselves. And I think that's unfortunate. So I think that I'm going to be looking at this strictly from where we can give the most maximum usage, and I'm more concerned about the youth than anybody else. So I think I'll leave it at that, Your Worship. I don't want to get into discussions and arguments as to whether I'm right in my belief or somebody else is right in their belief, because I don't think anybody really truly understands what's happening to us. And jurisdictions all around the world have been making mistakes. And we will learn over time just where we're really seriously at. But it's something we're going to have to learn to live with. Thank you.
Thank you, Councillor Berry. Next up is Councillor Lemko.
Thank you, Your Worship. As I sit here debating one way or the other and trying to take my personal feelings out of it, I feel it's quite unfair that the government has put us in this position, or put the people against each other and putting them in this position. We should be debating whether we have walking trails or sidewalks, and that's what, but here we are today, and I'm not professed to be any kind of a knowledgeable scientist when it comes to this. The vaccines seem to be proven that they're effective. Long term, we don't know. The reality that I sit and look is our hospital beds are filling up. Our healthcare system is being taxed to the point where they're discussing triage. And for those people who don't know triage, I ask you to Google it and find out how critical that is. There's people dying every day. There's people in ICUs and in hospital that cannot see family members because they're not allowed to. The decision I have to make is based on that, and but I do truly like that the town is, if we adopt the restriction program, we'll have some exemptions so the children can continue to play. It's a slippery slope we're on right now, and we're pitting citizens against one another. The system itself is going to make restrictions so that you can't go anywhere. You'll have to be in your basement and order Uber Eats if you're not vaccinated. And that's what the reality is. We're sitting here trying to balance it out, but eventually the government's going to step up and put something in because they have to. And here we are struggling to make a decision what's best for the community. So sitting here, I'm vaccinated. I'm not going to say I'm not. And for me, I'm vaccinated out of the fear of getting COVID. I lived it. I know exactly what's going on in the ICU because I was there. So that's the reality for me. So as we sit here pondering our decisions, I hopefully have this citizens of Vegreville respect that we are in this position today. Thank you, Your Worship.
Thank you. Councillor Brodziak is up next.
Thank you, Your Worship. Again, I'll echo the sentiments of the previous comments that were made, that this should not be a municipal councillor's decision. This should not be downloaded on this municipality or on any municipalities by the government of Alberta. This is absolutely not the right thing that we should be voting on today, again. So I'm going to make my decisions based on what I feel is the right thing to do for our municipality, probably to avoid lawsuits. So I agree that vaccination is effective I, however, am looking at the Canadian Charter of Rights and Freedoms that was signed April 17th of 1982, and I have to base my decision on that. So again, I understand how critical this is, and I would implore everyone to be contacting the province so that they can put restrictions in place and not download it on municipal councillors. Thank you.
Thank you very much. Councillor Waters.
So technology is great, right? All that information is out there, and it's hard to sift through the fact and the fiction. There's been many letters sent to council and to councillors individually. I've read them. I hear the concern and the frustration, and I get it. It's horrible. I'm not for or against vaccinations. I myself just recently got my vaccination. I was one of those that was skeptical of it, but I want to continue seeing my grandchildren. I want to go to my favorite coffee shop and enjoy my cup of coffee inside. Unfortunately, this is becoming the new reality, and I don't like it, but it is what we're faced with. It's sad, as fellow councillors just said, that the provincial government is passing these decisions on to municipalities again. We're not scientists. We're not doctors. We can't say that the vaccine will not affect you now or later. We can't say that it's the thing to do. We are following the professionals' recommendations, science, and I think as municipal leaders, that's what we have to look at. From the information I'm hearing from Dr. Henshaw and others in her field, getting the vaccination does not prevent you from getting COVID, but it means that you may get it less severe, less chance of taking up that hospital bed. Beds are one thing. The staff there is another. The health professionals, the people that are dealing with this. The beds can fill up, but they are being stressed. I don't want to be to the point where businesses are closing their doors again and seniors are stuck in the senior facilities, can't see their loved ones. There's been many discussions and debates with council, a little more heated than I've seen in the last 4 years, very contentious subject. Our freedom to choose is being taken away. Not fair. But we have to do what's best. We have to make a decision of what we think is best for our residents to keep them safe with the information we're being provided by our professionals. And that's where I'm going to base my decision.
Thank you very much. Next up, Councillor Warba.
Thank you. Actually, I wanted to start by just saying something that Your Worship mentioned, and I couldn't agree more. I understand every community has to do what they need to do, but we have to decide just solely based on Vegreville. No two communities look alike. No two communities have the same types of facilities or even service the same number of people. So I appreciate and respect what every other community has to do, but I don't actually care. We have to decide what we have to do for Vegreville. So I just wanted to bring that part. And I also wanted to thank the clarification, because the sad reality is we should all be reaching out to the province every day. That what they've done to us here is very unfair. They have done this for more than a year, where they have made announcements that are not clear, that leave a lot of gray areas. They continue to update their announcements as they go along the way. Changes just like, thank you, Paul, you just made, because I had literally sat in and listened to that exact same one, where everyone believed that they had to do one thing or another with facilities, and then it became clear that they were allowing an additional exemption. Well, that's very unfair to administration. It needs to be said that our staff here has worked very, very hard over this past year with ever-changing regulations, and they're doing everything they can. So it is appreciated. Any frustrations that you have heard have been frustrations with the province and the ever-changing rules. So I just want everyone to know that. I am not actually going to read 3 pages of stuff. I just didn't want to forget my things, so I don't want to scare the mayor. But I decided today that I was actually going to start by doing this a little bit different. I'm not going to get into a whole lot of the different things. I want to share something personal. I also want to just say what people have said, because what people are telling me is that they don't believe that they think decisions are already made. That's not true. This council's gone back and forth and looked at many options. And they also do care what's being said, but I'll share some of it just so that they feel like they're heard. When I say I want to share something personal, it's because I think it's not unrealistic to say I have spoken out against many restrictions. You've heard that. You've heard the pushback from me on several of these things. And it dawned on me at one point that it might be because people would assume that I am unvaccinated. They may do that because I don't speak about it. I don't actually think that personally that we have to tell people whether we are or we aren't. And I didn't ever want me saying I am or I'm not to impact other people. I think it's a personal decision, a personal choice. I want everyone to do their own research. Sadly, there is information on both sides of the fence, as we've heard. There's also experts, doctors and nurses that are speaking out on both sides, so it makes it very unclear to the average person like us who aren't medical professionals. Having said that, I am actually vaccinated, and I didn't recently vaccinate. I've been vaccinated for a very long time, and my decisions have every time been about me feeling that my job is to represent what I'm hearing from people, not my own personal opinion, because I did personally vaccinate. However, having said that, the reason that I'm sharing that I am today is because I want people to know that I respect the rights of people who are vaccinated and who aren't. I respect all opinions, and I respect how difficult this is on businesses. I tried to think to myself, what decision was I making, because I know that we do not impact what happens with businesses, but we are going to impact what happens with our employees. So I tried to think of some of the things that I've heard. I've heard arguments from people that say, well, you don't have a choice whether you wear shoes to go in a store or you wear a seatbelt to go into a car. The problem with that is when you're done going out of that store or you're done coming out of that car, you're able to take off those shoes or you're able to take off that seatbelt. So it's a hard decision for me to tell another person to have something in their body that can't be removed. And that's what I'm struggling with today. I think I said all that. I don't want to go too far into these ones here. What I do want to say, though, is thank you to anybody who reached out to us. I know it's really hard to write a letter to council, especially if you're feeling that you're not going to be heard. I myself have actually received dozens of letters from an interesting group of people, and it's something that I want to clarify. I have not just heard from unvaccinated people. At this point right now, I have heard from some town employees, some that are vaccinated and some that are unvaccinated. I have heard from some businesses. I have heard from some medical professionals. And of course, it's fair to say I, of course, have heard from parents. Everyone knows my role has been within youth sports. So of course, I've heard a lot from parents. And I've heard from parents of both vaccinated and unvaccinated youth. I greatly appreciate the clarification on some possible exemptions for youth, because I feel that the one last thing I wanted to leave everyone with was a piece from a letter that I got, and it said, Tina, thank you for giving me your time. This last year, I feel that our province and federal government has failed us. They have put us in a situation that has impacted our youth more than we can ever say. They haven't stood up for us, and they haven't made it clear. What I can tell you is my family themselves are vaccinated. We followed every rule. We followed every regulation. And the sad reality is some of the rules that come in right now would make it so that my vaccinated child and my vaccinated family cannot take place in activities. So the reason I chose to read that is because it factors very deeply into my decision as to how we treat facilities, because the reality is without us making this exemption that could apply to youth, it isn't just impacting those who choose not to be vaccinated. If a team goes down because of numbers, vaccinated children on that team also don't have a team to play with. And that's what's bothering me, is we can't simply say that it's a decision of you chose not to be vaccinated, because people who are vaccinated are being impacted by it. And that's one of the reasons why this has been weighing so strongly on it. For employees, I still am struggling. I still feel that I am opposed to this decision because it is not a provincial requirement. Also, employees are not required to have this in order for us to operate our facilities, even under the exemption program. And lastly, I always try to think about what it could mean for the town. And I am concerned about the liability for the town, because the province hasn't stepped up. They haven't made it a regulation. And if we choose to do this, it is the town choosing to do it. We're not following a regulation imposed on us. And I do believe then that we do risk that, what do we do with the employee that does not comply? Do they lose their job? Do they lose their livelihood? Do they lose their ability to earn a living? And then I wonder what that opens this up to, because I believe there will be charter violations. So having said all of that, that's what I've been taking into consideration. I want everyone to know that I respect the final decision that comes, and that, like I have in the past with issues that I didn't agree with, I'll fully respect the democracy that is decided today and support the town in that decision, but that's what will impact my final vote.
Okay, thank you very much. Councillor Rudick.
Thank you, Your Worship. I never thought this would be a conversation that would be held at this table. I realize that our role as councillors is to be leaders. Leaders in action and leaders in deed, but we are not thought leadership in that sense. We don't come up with the situations that are confronting us today. And for that matter, I think that that's one of the things that I'm trying to stick true to, is that our job is to make decisions. What we are tasked with as municipal councillors, municipal government, is to provide good government and foster the well-being of our community. We need to provide services and facilities and things that council and our residents consider desirable and necessary. And that's kind of been a shifting slope. The sand has been moving under our feet constantly. It's very difficult for us to be able to make those decisions with any certainty. And I implore all of the people that took the time and the energy to reach out and text and write and email us to please send those letters to the province. Because push that responsibility back where it belongs. It's inappropriate to push it back to us here. And I want to be very clear. This council is full of people that I respect. This administration is full of people that I respect. The passion that you see on this panel is not directed against each other in any way, shape, or form. We disagree about ideas, but we do not disagree personally. And I think that's where we tend to fall into the weeds. And some of the letters, while I respect the fact that you have passion, passion means that we care. But our community craves normalcy. We seek connection. We are looking for relationships. And for that reason, I think the proposal that our administration came forward with is a reasonable solution. I want to be able to provide normalcy and relationship for our children. I want to be able to provide facilities that adults can use for recreation to be able to weather this storm. And we don't know when the end will be there. So again, in order for me to do my charge as a councillor, I'm not a doctor, I'm not a lawyer. I am a municipal councillor, and my job is to provide good governance, maintain and develop safe and viable communities. And I think the way that we do that is follow the suggestion that is put forward by administration to have a hybrid model that allows us to be able to allow youth and adults to access our facilities at the same time protecting both the patrons as well as our staff. Again, I appreciate the fact that people feel passionately. That means that we care. This is not a decision that's taken lightly by any of us. And that's my perspective.
Okay, thank you very much. So I just want to say right off the bat here that I want to thank council. When the provincial government came down with the choices that we had to make, and our admin had got a hold of me and said that this was the direction they want to go, and I said, well, I want to reach out to council. And every member of council said that they did not want it to be left to the admin to make this decision, that they wanted to stand up and show leadership in our community in making these decisions. So that's where we're at today, and I want to thank everybody for saying yes to that. Not one person decided that they would turn away from because that's what we do as leaders. Do we always make the right decisions for every person in the community? No. But what we can do in a democracy is represent the best, or make decisions for the majority of our citizens. So moving forward, that's what we're looking at right now. It comes down to that old, is the privilege of being in a democracy, is it that one person's rights out-trump the health and well-being of everybody else? Well, we're forced in a situation today to make some decisions based on stuff that we're not experts in. But what we are experts in after 4 years is how our facilities work. And when we put huge restrictions on them, we lose a lot more money than we do every day. So the decisions that we're making today are operational and how we're going to use our facilities to the max under these new restrictions. Now, that being said, will be our first decision that we'll make. I want to thank everybody that wrote letters. We read all the letters, and we didn't have time to stand here, and a lot of them are so technical that it's beyond the realm of what we're into. Like, we're just making decisions for the citizens of Vegreville, how they're going to use our facilities. The next decision that we're going to make is how it's going to impact our employees, which is a very big decision. So I want to thank everybody that wrote letters, and I want everybody to understand that reaching out to the provincial government with your concerns when it comes to your own personal health decisions is probably the way to go. I mean, because we don't make those decisions. What we're making decisions on is how you're going to access, who will have access to our facilities, and how we can best utilize them for the majority of the citizens in our community. So again, thank you, and I want to thank the staff and admin, and let everybody in this community know that this is not easy for any of us. So we're going to start. Everybody's had their piece. We have two decisions, either the restriction exemption program modified the way that Paul Casey read it to us today, or we go back to the other restrictions. Go ahead, Councillor Riddick.
If I could please have Mr. Casey read that aloud again before we make our vote, that would be appreciated.
Okay.
Okay, so we will close the public workshop, the fire hall, the Vegreville Material Recycling Facility, or VMRF, the Visitor Information Center, which is closing on Sunday, and the museum for access to the public. We will continue to have the town office and the landfill opening with masking and social distancing required. Excuse me, and we will apply the full, excuse me, the REP for special social, for the social center, the library gym, the multiplex, and the aquatic and fitness center. And we will apply a hybrid restriction exemption program for the arena and the dance studios, which would allow youth activities to continue provided the following restrictions are met. They would be screened for symptoms, social distancing would be required, masking would be required except while engaging in physical activity. 1/3 of fire code capacity for spectator attendance, and attendees would be limited to single household or 2 close contacts if living alone. Any attendees must be masked and socially distanced. We would expect the youth organizations to police that, and if failure to abide by these restrictions by those organizations would result in the town implementing the full restrictions exemption program at those facilities.
And we are not looking to change the age group at all for the youth.
The youth would be anybody under the age of 17.
Okay, good.
17 and under, sorry.
Okay, so all those in favor?
Can I ask,
Sure, go ahead.
just for clarity then, on the social center, library, multiplex, gym, and et cetera, in order to enter there or to have any function, they would have to show proof of vaccination?
That's correct.
Go ahead.
And just so that we're clear for what the responsibility would be on the organizations, under the youth, for the spectators that would be reduced to the 1/3, would the adult spectators, because that's a very gray area, and I know 2 different municipalities are doing different things because no one knows what that means. Would the spectators that are adults need proof of vaccination or not, just so that we know what they would be asking to do? Because some are saying the spectators are covered because they've been reduced to 1/3. Some are saying they aren't, so I'm just wondering how
We
we
would
see
be,
that.
to answer your question, we would be applying the restrictions that are for if we didn't apply the rep, which means that they would not have to be vaccinated, but they would have to follow the other restrictions, the social distancing, the masking.
Councillor Badger?
And would this take effect immediately, or would it be in a few days? When would this take effect?
As soon as council passes it, it would take effect.
Okay, any more questions? Okay, all those in favor of the new policy as it was just presented? Unanimous, thank you very much. Okay, next, we're gonna go to the question is, what are we going to do about the vaccination for our employees? So right now, council has been advised, or recommendation from admin to council is that all employees need to be vaccinated to work for the town of Vegreville. Is that where we're at, Mr. Casey?
That is the recommendation from council, and I want council to know this was not an easy discussion to have. There were people who were not necessarily initially in favor of doing this. We understand that there are charter rights that would be violated. However, there also is a section in the charter that allows, section 1 of the charter overrides all the other rights. And so I'm not saying that we wouldn't get challenged, but we made this decision for the benefit of all of our employees, both vaccinated and unvaccinated, because we do know that the vaccine is not perfect and that the vaccinated people can pass it on to the unvaccinated and vice versa. And the worst thing that could happen is for somebody to have one of our departments, say Public Works, have a breakout and everybody's off work, the whole place is off work for 14 days and we can't do anything, and something happens. You know, we're looking at it just for the safety of all of our employees. So that's why the recommendation is there. And I understand that it's a difficult decision for everybody. It was difficult for us to talk about it. Nobody wants to make a decision like that. So.
Okay, Councilor Rudy.
It's unusual for us to make a vote or a decision that is on an administrative topic like this. I understand why it's come to us. Is the vote that we are taking right now to support an administrative decision or to direct administration?
Well, the vote would be that we approved the recommendation. That's what we would be voting on now. So this is not on the decision of admin. We were voted here by the community to be leaders, and that's what we're gonna do right now. We've been given direction, and we are going to either approve it or not. Okay, anybody else have any questions regarding this matter that we're gonna, go ahead, Cliff?
Actually, just a clarification on your last comment. It is, I had requested support or consensus of council for the decision that was, that we had proposed. Okay, so that's what I would ask if you're going to make a motion, that it's in support of the administrative decision. Okay, and just as a point of order on the first one, there wasn't a motion, so it will read a consensus of council.
Oh, okay, so yeah, no one made a motion, okay, yep. So, that's fine, I mean, it was a recommendation, we voted on it, we know where we're at, so
Okay.
it'll be consensus of council, so.
Consensus of council.
Okay, so, does anybody got anything else they wanna ask or make a comment? I would ask you make it short, but, is anybody anything they wanna say? Seeing none, I would take a motion to support this then. Well, I'd look to anybody because we're all gonna vote on it. I mean, I know that you put your hand up a lot because a lot of people are sitting here looking at me and wondering what we're gonna do next, and I appreciate it.
Yep, I'll put my hand up. I'll put forward the recommendation to support the administrative decision.
Okay. I'll call a question. All those in favor of making it mandatory for the employees of the town of Vegreville to have a vaccination, all those in favor, raise their hand. Okay, thank you. That motion was defeated.
Could you please ask the question, those not in favor?
Oh, you're right, yeah. All those not in favor. Okay. You want to say something? Go ahead.
I just have a question. So as that motion was defeated, what steps will happen now for administration, and where will we go from here?
We will get together as administration, as senior leadership, and discuss this. Thank you.
Okay. So that is what the meeting was about this morning. We've made our decisions, and I thank everybody for their input and their views, and so I will now adjourn this meeting.